This conference will now be recorded.
The Mental Health Services Act.
Awesome, thank you, Bailey. And I apologize for that. What hopefully was not really loud on your side. It was really loud on my side when I clicked to record the meeting. We want to make sure that people who couldn't be here today will have an opportunity to see what we talk about today. Okay, Carol, you are next.
Can't get my video to work, but my name is Carol Uloa, and I am the Division Director of the Community Corrections Center with the Probation Department.
Welcome, Carol. Daisy. I don't see Daisy on my line. Oh, there she is. Her screen is red. Daisy might be camera shy. Daisy is our one of our local wonderful reporters from Channel 7. Diane sent a message saying her microphone's not working, but she says hello, everyone. Janelle.
Hello, I'm a clinical division chief for HHSA Adults Division.
Hi, Janelle. Jake. Jake's actually doing me a quick favor.
I'm an analyst in the Office of the Director.
Hello, welcome. Thanks, Jake. Jamie.
Hi, my name is Jamie Anderson. I am with Avenue Real Estate in Reading, and I'm just here to listen and learn.
Awesome. We're happy to have you. Josie.
Hi there. I'm Josie England. I'm a peer support specialist with Shasta County HHSA. And I'm here because it's a stakeholders meeting, and to a degree, this has to do with our team and our peers.
Wonderful. Thank you. It's nice to see your smiling face. Jill.
Hello.
Hi, Jill.
Hi. My name is Jill Lees, and I was a kindergarten teacher not just kindergarten, for 20 years. And I am just here to get information and see how I can help.
Outstanding. Thank you for being here. We're happy to have you. And Julie, you're next.
Hi, my name's Julie Calkins. I'm the Recovery and Activities Coordinator at Sunrise Mountain Wellness Center.
Excellent. So happy to have you. Thank you. Katie Cavagna.
I'm Katie, and I'm the case manager at Shasta County Mental Health.
Awesome. Thank you, Katie. And we have another Katie, Katie McCullough Stubbs.
This is Amy, Jamie, and then you. I thought it was Josie. There's a girl that talked right after Jamie. Okay.
Hi, I hear background noise. I don't know.
Yes, me too. If
there,
there we go. Okay, great.
I'm Katie McCullough Stubbs. I'm the Executive Director with Victor Community Support Services. We're an org provider that contracts with the county, and we serve children and families 0 to 21.
Awesome. Thank you, Katie. Laura. Okay. Okay, it's a little hard to hear you, Laura, but welcome. We're happy to have you. Lynn, hello. Good morning, Lynn.
Good morning. I'm Lynn Erickson with Circle of Friends in Bernie, a program of Hill Country Health and Wellness Center. Thank you.
Great to see you. Melissa.
Hi, I'm Melissa Field. I'm a senior analyst with Health and Human Services Agency.
Welcome, Melissa. And Ted just disappeared. There he is. Hi, Ted.
Hi, I'm Ted Rios. I'm fiscal support for MHSA.
Welcome. Thank you for being here. And Tina.
So I'm Tina Stefanich, Program Manager of Sunrise Mountain Wellness Center, and we're very interested to hear all your hard work in COVID reentry. Definitely. Thank you. I just wanted to say, Carrie, thank you for all the hard work you and your team have been doing, because it has been phenomenal. I'm so appreciative.
Well, thank you so much. That's so kind of you to say. And I'm super glad that you're here. I have your newsletter sitting right here. We're gonna talk about some of the cool stuff you guys are doing. I'm glad you're here to represent. And Vanessa.
Hi, my name is Vanessa Schofield. I'm an LCSW mental health clinician for the Reading Rancheria. I also work with the Life Center as the Teen Talking Circle reproductive health facilitator. I also work with NADA, the Native American Training and Technical Assistance Program for Northern California, working with families, Native American families that have youth with disabilities, navigating the program and services available to them.
Okay, awesome. Thank you. It's great to have you here. It's always good to have folks who are representing the youth too. So we're grateful that you're spending your morning with us today. Is there anybody from the phone that has not had a chance to introduce themselves, or anybody that I skipped? I went through the list, but if you
Carrie with PSA2 Area Agency on Aging. I'm here representing and advocating for older adults, and we serve 5-county area of Lassen, Modoc, Shasta, Siskiyou, and Trinity counties. Thank you for inviting.
Thank you, Terry. It's great to have you.
Hi, Carrie. This is Shannon Hunt, and I am a family member of us here.
Oh, okay, welcome, Shannon.
But I mean, a lot of times the schools take care of, they do their own tracing.
I'm gonna mute caller 8 because I think they're not sure that they're hearable. Anybody else who did not introduce themselves who would like to? Okay. All right. Well, thank you again, everyone, for taking the time to let us know who's here. It's always nice to know who's in the room with us. We are usually at these meetings, we pass out a demographic form so we can get a good idea of who is attending these meetings and to make sure that we're talking to people from all kinds of different groups. It sounds like from the introductions that we've got people representing all kinds of demographics. So that's fantastic. We want to make sure that everybody's voice is heard. So we're going to try and send you a link to a demographic survey so we can collect that information. Stand by on that. We don't have that quite ready for you yet. I had not thought that process through. So I apologize for that. This is my first giant go-to meeting. I've done a lot of little ones, but this is the first one of this nature. So I appreciate your patience with me. I much prefer to be in a big room with all of you where I can see you and talk with you. We usually have a poster up in the room about the safe meeting guidelines, and I'm just going to give you a quick summary of what that looks like. And basically in this format, it means that if it's not your turn to talk, please put yourself on mute because it can be really distracting and hard to hear when when somebody else is talking in the background. Please do speak up if you have something to say. Everybody's voice is equally important, and we invited all of you here because we want to hear from all of you as we move forward in some of these endeavors that we're working on. And we'll talk a little bit about who is a stakeholder. Stakeholders are people who have an interest in the mental health system for one way or another. Sometimes it's because we work in the mental health system. Sometimes we have a family member who has a mental health condition. Sometimes we have a mental health condition. Sometimes we live in a community where people have mental health conditions, and of course that includes all of us. So regardless of where you fall into that spectrum, or if you fall like I do into many parts of that spectrum, please know that that your input is unique and appreciated. So thank you for being brave enough to show up first and then to speak up when we get through some of these agenda items. Does anybody have any questions or concerns or challenges or anything of that nature so far? All right, moving forward. I wanted to give you first an update on the 3-year plan. Because of COVID, the state instituted a provision where we could extend the effective time frame of our annual update to include the last fiscal year. So we did take advantage of that because we are a fairly small staff, and many of us were reassigned 100% to COVID-related activities. So we were really close to getting that 3-year plan completed, but we did not, and then it stopped. It's been on a long pause, let's put it that way, for about a year. As you might know, that's the 3-year plan is a big document that governs what we do with Mental Health Services Act funding. And if you're not familiar with our website, ShastaMHSA.com is where we keep all of our things. And if you have the luxury of being able to look at 2 things at one time, if you can look at our meeting and then also look at the website, that might be helpful. We've got a few things posted on there that I'll direct you guys to. You don't need to look at them right now, but if you wanted to follow along, that would be just fine. So I will be bringing to you the updated plan that will go to our MHSA plan goes to the Board of Supervisors. Before that, it goes to the Mental Health, Alcohol, and Drug Advisory Board for review, and then it goes up to the state for approval. But we will not have a meeting between now and the time I submit it to the Mental Health Board, but I will send it out to that email list that hopefully is how you receive this invitation. If you received this invitation in a different way and you did not receive an email from Shasta County Mental Health Services Act, please let me know, and I will make sure that you get added to our list, because we want to make sure that you're looped into all of those communications. I promise that I will not send you tons of things. I only send things out when it's important things that I'm interested in your input on. So I promise not to spam you if you send me your email address. Does anybody have any questions about the 3-year plan? Okay. I wanted to give you an update on our new prevention and early intervention plan. This might sound a little bit jumbled to all of you, and I appreciate your grace and patience with me because it's been a really long time since we last met, and I'm going to try to remember all of the things that you don't know yet so that I can share them with all of you. One of them is we did what's in the county, it's called a request for proposals. And that's when we send out a notification to everybody all over saying, this is a service that we want to provide in our community. And if you're an organization that provides that kind of a service, let us know and tell us how you would like to do that here in Shasta County. And so we did that for a new prevention and early intervention project. And the project that was selected is called INVO. And I had a really good explanation about that from Miguel Rodriguez that I thought that I printed out, but I didn't. But fortunately, here we are with my email. So INVO, the INVO/Impact program launched in last October, to serve youth identified through SCOE, child welfare, and mental health as benefiting from early intervention services. So that's something that it's fairly new since it happened in October. It took a little while to get through the process, and then it took a little while to get to a place where we could talk about something that wasn't COVID related. So stand by for more news about that. It's seems to be working pretty well so far. So far, they've given training about their services to the Shasta County Office of Education, Children's Mental Health, Child Welfare, and Children's Services Leadership Team here in the HHSA. And they've referred about 35 kids to this program. And I'm just going to read to you quickly what Miguel said about it. They've begun to deliver both applied behavioral analysis services and mental health services to children. They have a clinician, a registered behavior technician, and a board service certified behavior analyst who are working on assessments and direct service delivery. They've come into a couple, bumped into barriers that, they're navigating through, just like it happens with any kind of new programs. And so we continue to move forward in working with them to try and provide some of those services to local youth. And then I also wanted to give you an update on our new innovations proposal, the Hope Park project. And if you remember, very long ago, I want to say it was probably, boy, close to 2 years ago now, we started talking about our next innovations project. Our current innovations project is the Care Center, which is operated by Hill Country, and that is transitioning out of an innovations project and into just a continued project that's funded through a different piece of the Mental Health Services Act. An innovations project is a project that is new and innovative and has never been done before anywhere. So as you can imagine, if you've heard me talk about this before, it can be really challenging to think of something that fits that criteria because so many counties have tried so many things that are unique and interesting with mental health services. So our stakeholder group, all of you, some of you were there through that process and helped provide ideas about what we wanted to do for our next innovations project. And what you all helped identify was that we've got a lot of youth who have high rates of adverse childhood experiences, which leads to unhealthy behaviors sometimes when those kids grow up and become adults. You also identified, and I know that that Terry Gabriel and her team were part of helping us see this piece, was that our older adults often tend to have isolation problems with depression and things like that when, you know, perhaps you lose a family member or you've retired from a job, and you know, those big life changes can be really hard on our older adults. And so this group, the stakeholder group, wondered if we might be able to create an intergenerational project that benefits both of those groups at one time, which sounded pretty smart to me and definitely innovative. So we put out another one of those requests for proposals where we throw the idea out there and see what comes back to us. We had, I want to say, about 5 or so responses to that. And the project that was selected through the county process that included some county staff as well as a mental health, alcohol, and drug advisory board member. They selected the Hope Park project, and that one probably sounds familiar to those of you who have been at stakeholder meetings because the executive director of Pathways to Hope, Michael Burke, actually came to a stakeholder meeting to describe to all of you what his vision was for that project. So if you remember that was the one. There were a couple of other, good, interesting projects that came up in that process, but that was the one that was selected by the group. And so we presented it to the Mental Health, Alcohol, and Drug Advisory Board, who approved it. And then we brought it to the Board of Supervisors recently, I want to say within the past month or so, and they approved it with a 5-0 vote, which was remarkable and really, I think, spoke highly to that, that leadership group's opinion of that project. So the next step is that we take it to the State Mental Health Oversight and Accountability Commission for approval. We're ready to go right now, but that commission has to approve they approve projects for every county, and I won't get into great nitty-gritty details because it's not super interesting, but if you don't spend your innovations dollars by a certain time period, they revert back to the state. And of course, nobody wants that. So we are not at risk of reversion to the state this year. And so that commission is prioritizing those projects in counties where they would have to give the money back to the state, which of course makes sense. We want to give those guys the opportunity to get their projects pushed. They're first in line, definitely. And then hopefully we'll be up sooner than later because we have a very eager group that is really ready to get started on that. I can't remember if I told you anything about that. Let me give you a brief, just a super brief update. That's another thing that's listed on our website. We have a link to the actual project. And in a nutshell, it's engaging older adults to work with kids, and they're going to be doing some high energy activities. So active types of things will be hiking and doing outdoors activities and things of that nature, where they would be building those relationships. And then they are going to use the Anderson Teen Center and then what will eventually be a new Reading Teen Center, with the hope of potentially expanding to a Shasta Lake Teen Center, because we know that that's needed up there as well. to continue that mentorship. So they're going out and they're having fun together, and then they come back to the teen center and they're doing things like, they're doing activities, but they're also doing things like homework. I know nobody wants to do homework, but so that they have a caring adult in their life who is helping them, mentoring them, talking to them. Mike has talked about having big kitchens in the teen centers where the older adults can teach kids how to cook. But not only is he going to teach, are they, the older adults teaching them how to cook, but they'll prepare a big meal together that child can then take home to their family. And then they sit down and they, and they say, okay, everybody, let's sit down at the table together and have dinner together, because we know that also helps build strong family relationships. And so we're hoping that it's going to have a ripple effect. It's going to benefit the older adults because it's going to give them something really meaningful and really important to do. It's going to benefit those kids because they've got somebody who's a caring adult in their life who's really invested in them. And then it's going to help that generation in the middle, the parents of these kids, because somebody if you're a parent or a grandparent, you know that it can be challenging at times to do all of the things that you're expected to do in your life and come home and do homework and pay the bills and all of those things. So having another invested adult in your child's life is we don't see any downside to that. So so stay tuned for more information about that. We are once we get the approval going, I think if you saw Mike's presentation, you know that he's a pretty dynamic, very energetic guy who is ready to get going as soon as we all have the green light. So I've just been talking really a lot. Does anybody have any questions or feedback about any of the things that we've talked about so far?
This is Terry Gabriel with PSA2. Thank you so much for including the older adult population in the MHSA plan. It is very important, especially during the pandemic, to address isolation and loneliness that the older adults are experiencing, and we really appreciate the effort. Thank you so much.
Yeah, thank you for all of your advice and your colleagues' input into all of that. It was great to hear their feedback. Okay, on to our next thing, if nobody has any additional questions about Hope Park. Okay, this one's a hard one to explain, so I'm going to do my very best. We have an opportunity to participate in a multi-county innovations project that was actually suggested by the Mental Health Services Oversight and Accountability Commission. That's that group that approves these. So chances are it's going to get approved. And what that would do is it would create what's called Psychiatric Advanced Directives. And what that is I think we all generally know and understand what an advanced health directive is. Like, we know that if we have an advanced health directive, that if we were to become incapacitated in some way, whether we want to have life-saving measures used on us or not, and all of those different things that go along with a physical health catastrophe of some sort. The Psychiatric Advanced Directive talks about what you want to have happen if you were to experience a psychiatric problem. For example, if you were to be placed on a 5150 hold, things like what medications I do not want you to use on me, what types of, if you want restraint used or not, if you want what people should be contacted. It's this super big project, and it's really hard to describe in a short little snippet of time. So I'm going to look at I've posted the abstract on our website, and here's what it says in the beginning. It says that Psychiatric advance directives are a form of supported decision-making that help reduce reliance on crisis and involuntary care. They have the potential to enhance individual independence for people with mental health needs and related conditions in the areas of daily life, education, housing, medical, employment, and financial empowerment. The goal is to help counties improve their access to the appropriateness and quality of care while preserving the individual's life goals and mental health preferences. They serve to improve positive outcomes for consumers at risk of involuntary care, homelessness, and unnecessary hospitalizations, and involvement with the criminal justice system through all stages of life. Psychiatric advance directives are a means for increasing self-determination and autonomy by encouraging and empowering individuals to make decisions about their own lives. I have been participating in the preliminary planning efforts for these because it sounded like this might be something that our stakeholders would be interested in us diving into. And I'm imagining that other counties are going to jump on board also. Right now, Orange County, Fresno, Monterey, and Shasta County are the groups, the counties that are interested in moving the project forward to create a statewide initiative. There are so many pieces of this puzzle that it's hard to know which pieces to share with all of you. But what it would do, it would create a toolkit that could be easily replicated from county to county, because that's part of the issue, right? If you know, how does somebody know if you have a psychiatric advance directive? We need a place where they all go. We need law enforcement and hospitals and, you know, all of these other affected organizations to know where to look if I am placed on a hold or if I'm put into the hospital. There has to be a centralized place for people to know where to look so that they know what my wishes are in the event that I don't have it on my person. So many pieces to it. It would rely heavily on peer support specialists, so I'm super happy that you're here, Josie, to represent the peer support specialists. I think I saw, so Denise is here too. Two of our fantastic peer support specialists. And they would help people create those documents based on really understanding how to best connect with people and to help walk them through that process. The way that it kind of looks is that, for example, if Josie was helping me fill this out, she would be talking to me and we would just be having a conversation. And then there would be another person who would be writing down my wishes. So Josie's not, you know, interviewing me with a notepad and, you know, looking at this big official scary document as we're talking about this, you know, subject that is really heavy, right? So she's having a conversation with me because that's what her beautiful skill set includes. And somebody else is helping to take the notes to collect all that information. There are so many more pieces to it, and I'm not, I don't want to take up a huge ton of time on it, but I did want to let you know that there was an informational meeting about it a couple of weeks ago, and a couple of members of our stakeholder group did attend. If you are interested in learning more, there is a flyer on the Shasta MHSA website that talks about another informational presentation that's on April 7th. So if that is something that is interesting to you and you want to hear from the people that are really doing all of this heavy lifting with the planning, we certainly invite you to listen in on that presentation. Otherwise, I'm going to do my best to keep you all posted about where we are in the process and what we learn along the way. Does anybody have questions about that? Okay, oh, great. Okay, so Josie and Denise both said that they've done this with the crisis portion of WRAP, which is the Wellness Recovery Action Planning. And I know Julie is also very, very well versed in the WRAP program, which of course is heavily used here in Shasta County. So that's great. And that is definitely one of those things that the people who are coordinating this have talked about, is that it's kind of the last step in the WRAP process. So that's great to hear that that you all are familiar with this process too. Did you guys have anything else to add about that?
I know I was curious about how that is going to differ from just the components. So I guess I'll read up on it. I'm really interested in seeing how it differs from the crisis plan and RAP. Post-crisis is the very last portion of RAP, and crisis is right before that. But it's pretty extensive in terms of you can have it as detailed as you want it to be. And so I'm really interested in seeing how this works. It sounds like there's more involvement. There's more people who can be involved with this. And of course, you can have as many people involved with your own personal RAP as you'd like, but it sounds like there'll actually be a person there writing it down for you. And so, and an advanced directive, isn't that notarized? Isn't there like an official notary that goes along with that? Okay, so yeah, I do have a lot of questions. Sorry, I'm like sitting here like my brain is like going.
Yes.
I'm actually glad to hear that there is going to be a psychiatric directive, because I think that's going to be honored, where sometimes even if you have a RAP plan, you can take it in, but it's not necessarily honored to your best wishes. But having the state involved and having a wide state plan where this is what this person, that means that person's wishes are really to the of that very client centered, so that they feel more supportive. And so I'm very excited about this, that this is the more legality of being honored in that respect. So I'm excited.
Yeah, Julie.
I wanted to say that many times with RAP, people are encouraged. I mean, if people want to do an advanced directive, they do that as part of their as part of their crisis plan. And have it notarized and signed and stuff like that. So it might be something that's compatible with RAP, that as we deliver RAP, we could also provide the access to this advanced directive, this psychiatric advanced directive.
Cool, that would be fantastic. And we definitely will be leaning on all of you and your expertise. Yeah, Tina, go ahead.
I had a quick question, because I've worked with medical advanced directives, and one of the side effects of this that I had seen is that family members don't always abide by the advanced directive, even with a notary. So even with it notarized. So I say that out loud because that is a real barrier for this actually working well. So utilizing the RAP method or methodology in there, can we also figure out how to get that component bridge so that it actually does work? It's really frustrating when you're like, really, dude, this is there, and so yeah, just see that as it could go really badly too. Just wondering if we have a process in place to deal with that objection or those that problem.
For sure, and point very well taken. That's been one of the challenges that has that arose very quickly when this group of folks have been talking with the consultant about next steps. And this is going to take years to get rolling, but yes, that's one of the important pieces, is that it won't work if it's not a system that can be easily accessed by everyone who needs to be able to access it, and that everyone knows about it. You know, if law enforcement doesn't know that this system exists, it's not going to be very useful. So there's a lot of education and foundation building that has to happen before we can actually start telling people, hey, here's the template for the psychiatric advanced directive. So yes, lots and lots of work to still do on it, but it sounds at this point that Shasta County is interested in at least learning more. And I'll continue to keep you all updated and continue to get your feedback on whether you think this is still something that we want to continue to move forward with. A couple of the highlights from some of the conversations that we've had with the consultant, and then a person who works in Texas who has done psychiatric advanced directives, has said that that it can include things like, of course, medications and preferences for emergency treatment, but also additional wellness tools that they find helpful. And I'm imagining that ties right in with the RAP that you guys are talking about, right? Like things that are important to me. I like to be able to read, and some medication makes it hard for me to focus. I like to take walks, and some medication makes it difficult for me to move well. Things like that, that it's important for the people who are in charge of your care to know in order for you to be able to get through that crisis.
Or even I like the part that you said about being restrained. You know, maybe someone can calm themselves by having a supporter around rather than a restraint, because restraining itself is traumatizing. And that actually has made me as a peer, when I'm restrained, that just, instead of de-escalating, it just escalates.
Right,
So,
it makes it worse, right? And that, yeah, we don't want that to happen. So we want to know, if I'm looking at this piece of paper and saying, okay, these are things that I know help calm me down. And so try this first before you try these other things. Sometimes having a man engage with them may be traumatizing as opposed to having a woman engage with them, or vice versa. And so just knowing those things that you wouldn't know just by looking at someone. So we're hopeful that this is going to be something that's going to really help empower people, even when they are not, even when they are having a mental health crisis. And then we would go to places where people with serious mental illness are, to help them be aware that this is an option, and to help them fill this out if they so choose. Yeah, Julie, go ahead.
Yeah, I want to say one thing that WRAP does in particular is help people engage their support so their supporters know. That would really help bridge the issue that Tina is raising about families not respecting the advanced directive. That in WRAP, we work with people to learn how to engage their support system, so their support system is supportive of their choices. So
right, super helpful. And so Julie, are you suggesting that perhaps in the advanced directive you would say, if I am in crisis, please call my sister at this phone number? Or
yeah, I think that one thing that WRAP does is you identify who's going to be your supporters and specifically how they're going to support you, whether they're going to be one person who's in charge of your WRAP, whether it's one person who, you know, who takes over in a situation where you're unable to care for yourself. But you identify specifically who that is, and you have a relationship with them. They already know in advance. It's not a surprise to them when somebody needs something. It's not a surprise that when somebody needs this, when they're in a crisis, it's not a surprise who's going to be taking over or who's going to be managing that. And also the specific roles that each supporter plays, whether that's cooking a meal or watching children for you if you had to be hospitalized, or you know, picking you up from the hospital when you need to get home. It's very detailed and very specific if somebody chooses to do that with their WRAP.
that's fantastic. And here's another sales pitch for WRAP. You should definitely have a WRAP plan. Those are so awesome. Really, really helpful. And I think WRAP plus the Psychiatric Advanced Directive, one of the things that the consultant said was, in places where these have been implemented, there's always been and continues to be, and there has not been a great solution determined yet. It will be to have a centralized location and a lot of awareness about these, and so people can find them if needed. But also they have said that once somebody has a Psychiatric Advanced Directive created and they own it and they know that this is the plan if something is to go sideways with me at some point, then they come back for other services. They feel more comfortable going to mental health or a wellness center or somewhere to get services, because it helps put that power back where it belongs, in their hands. So I'm also really excited about that opportunity, that that may in fact help connect more people with services who may have been wanting services for a long time, but they're afraid, right? They don't know what's going to happen to them. So anyway, lots more to come on this as we continue to move forward with that, and I'll be sure to keep you all updated as things go on. Did anybody have any other thoughts or feedback on that? I see that Stephen has some comments in the chat that you all can refer to about some of the challenges that we're facing in our culture with some people who are not as empathetic to those with mental health conditions as others are. Anything else?
I think, Carrie, too, if I may, the advanced directives help empower the consumer to take control of the advocating for what happens to them. It also helps us understand that we do have a voice even when we are voiceless.
Yes.
And that we can put this plan in play for others to follow up on, to advocate for us on our behalf. That is huge. In the times that I've done advanced directives with patients when I did hospice, it's really empowering because it's really confusing to do it when you're stressed, like i.e. you're in the ER and the nurse comes to you with a packet of paper and says, here, intubate, not intubate, breathing tube, no breathing tube, feeding tube, no feeding tube. And you're like, and that's how it's presented, but you don't get all the other nuances. Like after the heart attack, what is the percentage rate of them being able to recover to where they were before they went in before the heart attack? That's the part we don't know. We just think they're going to come back exactly the way they did. Actually, that's not true. Most don't. 14% maybe, depends on your age, comorbidities, all kinds of stuff. So these are things that we don't think about because we're well right now, or we're doing very well, or we don't think that oh, that can't happen to me, but you don't know that. You don't know anything could happen. So I just put that out. Like, I love the way that you guys are talking about this, or that we are talking about this, excuse me. I love that you're pursuing this. I also want to caution and inspire that see that there are, it's not perfect. It's never perfect, obviously, but that this is a great peer tool that anybody can do that. So I know we're going to put this a lot in the peer department, but I also see this like, Julie, man, we're going to have to do this. Get ready. And so I thank you for the opportunity for this. And then what can we do to help support the greater community in getting this information out so that we are primed and ready to receive it, so that there's not a lot of pushback from consumers to embrace this? What can we do to support you?
That is a great question, and I anticipate that we will have some good solid answers to that sooner than later. I'll be sure to send you a link to that informational presentation in case it's something you guys want to listen to. In the meantime, I will continue participating in these county-to-county meetings where the consultants moving forward, and we're just kind of on board. That one of the beautiful things about this project is that somebody else is doing the heavy lifting with the creating of the plan and the working with the Mental Health Services Oversight and Accountability Commission and all of that bureaucracy. It will cost us something. We don't have an exact price estimate. In my view, we have the money to do it, and it seems like I'm not the only one that thinks that this is something that could really benefit people here in Shasta County. And the more counties that sign on, I'm imagining as the word kind of starts to spread, I can't imagine a county that doesn't want to do this. And so I'm imagining more people will jump on board, and then the cost will be shared by more of us. So I'll keep you updated as we learn more, and be sure to let you know if there are any places to plug in as stakeholders that I make all of you aware, so you can dive in and share your feedback, because each of you brings a unique perspective to this whole process. And if you can't participate, you can let me know what your thoughts are, and I can represent on your behalf for sure. So that's my exciting news about that. We usually do in these meetings, we usually go through the various MHSA programs, and I give you an update on what's going on. I don't have a ton of things to share, but I did want to just quickly run through. We've got a partnership with First 5 Shasta and Pathways to Hope and us at Health and Human Services to help kindergartners and their families who have had attendance issues in kindergarten, try to help kind of build those strengths with families so that they understand the importance of going to kindergarten, and that helps build those good healthy habits moving forward, because we know that it's great and important for kids to be in school for so many reasons. Triple P is continuing with its quarterly stakeholder meetings, and hopefully expanding that. They're looking at some new levels of Triple P. They're going to do a community campaign starting next month to help get the word out about Triple P resources in the community. That was one of the things that we had talked about at, I think, our last stakeholder meeting, about people are not as aware of Triple P as we would like. So we're going to try and fix that. At-risk middle school, they're still working with Anderson Middle School with NAMI's counseling to provide BOTVIN life skills programs to 6th through 8th grade. They expanded in 2020 to Turtle Bay, Pacheco, and Happy Valley schools for 5th through 8th grades. So that's one of our at-risk middle school projects. Our suicide prevention folks, they have 9 question, persuade, refer, or QPR trainers in Shasta County, and several gatekeeper trainings have been provided to community members. Captain Awesome, you guys might remember that he is our local suicide prevention superhero who talks about men's mental wellness and how it is cool and important and necessary for all of us to care for our mental health. They designed a really cool new logo with input and feedback from the Men's Advisory Group, and that group meets again in May. They've completed a television commercial, which should be advertised in our area soon. And they are always looking for local men to participate in Captain Awesome campaigns by sharing a mental wellness or resilience tip. I don't know if hopefully you've seen our Captain Awesome campaigns. We've got a variety of them, people with, I play baseball, or I work out, or I play with my kids, or I go work on my car, or, those things that talk about we have strayed from actually using the word suicide with that group because that did not resonate well with the Men's Advisory Group, but it really is just trying to continue to normalize help seeking among men who are not always inclined to do that. I think those are the big updates that we have. I know Christopher's Stand Against Stigma campaign has continued meeting in this weird, funky format during COVID. Chris, did you want to talk about any of the things that your group is doing?
Sure. So we're going to have a, there's still some details being nailed down, but we should be having a drive-through Minds Matter mental health fair this year. And that will be taking place on May 1st. So all the advertising and such should be coming out this week, if not early next week, and how to participate and all that. So it's going to take place on the, actually down on Breslauer Way in the parking lot of, we call it the Cascade Building. That's where a lot of people go to sign up for benefits and such like that. So it'll be in that parking lot and from 10 a.m. to 2 p.m. So during that time, you can come by and pick up a bag of resources, community resources. And we'll be reaching out to other organizations soon to collect materials from you. So if you have any brochures or flyers that you would like to share, please let me know. And yeah, so we will be doing that. Kind of keeps getting pushed back because of COVID, but the Stand Against Stigma website is still something that I'm hoping to have up by May, so we can launch that then. So that's new to the community. That goes and basically takes all the Stand Against Stigma programs that have been created over the years. The program's been around since 2012. And it takes them, they were kind of all spaced out on the county website, and now they're all in one location with all the information that you would need to participate in any of the programs that we have, Hope is Alive, Open Mic, the Stand Against Stigma committee meetings, and all that. So all those things are to come. And let me see. We've also, even though it has been very COVID, we have also been able to push out some of the Brave Faces physical galleries. There's one hanging in Shingletown Medical Center now that was installed in November. There's one at the county admin building right now. We have Shantae Cat, hers is hanging up there. And then we sort of shifted around some that are in the county mental health building. And I'm hoping to get more of those out there because we have a few sets left. So if you have office space and would like to arrange that, you can contact me as well. And I think that's all that I have for now. There's more to come. There's always more to come with Mental Health Month coming up. But yeah, I think that's it for the time being.
Thank you, Chris. Thank you for letting me put you on the spot. I'm good at that, as you know. Okay. Anybody else from the county or any of our other community partners have any updates to share about what's going on mental health wise with your organizations? I'm kind of switching those two things, but this feels like a really good time to do that. So let's do that first. I know Tina's crew has some stuff. You guys changed your name and hopefully are going to be opening in real life at some point soon.
Oh, we can only hope. Yeah, so we're closed partially because of COVID, but we have a new building and it's being there's being some redesign done. And we were told February, so as you can see, we're behind schedule. Unless I'm in an alternate universe, it seems like that's going around a lot today. But anyway, I'm hoping by June. I'm so hoping by June. So it gives us a little time to get vaccinated, gets a little time to ease into back into in person. I don't know about you, but the anxieties are high right now. The center's been in Zoom for a year as of the 21st of March. And in that, we've seen some growth. I was very surprised by that. Honestly, I just thought, I mean, let's hope we keep people together, keep them from going 5150, keep them supported, not so isolated. And it worked. I'm happy to report that we've had great success there. And freed up beds, keeping beds free for people who really are in the community that can't get housed or really going through some serious stuff. So that made me very happy. I've also seen some tremendous wellness growth. Our team is new, as you've met our new recovery activities coordinator, the amazing Julie Calkins. I'm so thrilled she took that job. I was like, please. No, she came running. It was awesome. Such a joy to work with her. We have since collaborated and joined forces with Shasta County Peer Support Team. Thank you, Josie, Denise, oh my God, Amy, John, there's Jules, and Jennifer. I think I forgot one person if I did. Oh yeah, Rhonda. So yeah, the amazing Rhonda. And so it's been an absolute pleasure working with you. They are supporting us in groups. They are taking groups, which is awesome. And I love that we're getting this symbiotic support going in connecting our programs. So it's not like, here's a center, you can go visit there, hang out for the day, get some respite, play, make an art project and go away. It's much more involved than that. And we're seeing some tremendous growth out of it. We're also seeing new peers budding up. And so it's exciting for that. If you are not receiving our newsletter, I highly recommend shoot me an email. Julie's done an amazing job with that. I can't take any credit for that. That is 100% Julie and Jules. So, and the members, I might add. So we're having peers right into it, community collaboration happening. So if you want people to know about your services, you want to partner and collaborate, please. I'm always looking for collaborations. Send me a one-pager. I will put it in our newsletter. It's the best way to get it out. And we send it all over the county. And then because we are now a Kingsview Behavioral Health Systems program, it also goes to Fresno. So that's kind of cool. So we infect all those other programs because there's 5 wellness centers that Kingsview oversees in the Central Valley. So that's really cool. Thank you, Julie. It's please, Julie just put her email in the chat box, so please hit her up for that. And we would love to see more collaboration and partnership. We have resource pages are growing. We started with 1 and now we're at 5. We're about to start 5. If your resource isn't on there, I'm sorry, that wasn't intentional. I just didn't know. So please send me something and I will throw it in there. Direct me to your website. we will capture everything and put it together in a little box so that people know that your service, your resource exists in the community and that they can go for it. And anyway, other than that, the beauty of the new center is it's huge. It's going to be a lot bigger. It's 2.5 times, I think, the size of Oldberg. Oh my God, can I just say thank you for that? It's over 2,200 square feet. It has a full teaching kitchen. That's what's probably taking a wee bit of time in the construction. We will have a full kitchen to teach people how to cook, how to put good recipes together that support mental wellness and health, and have fun doing it. And yeah, and do some, hopefully when it's safe to do, community meals. I love doing community meals. So that should be a lot of fun. And yeah, so I look forward to great working with Bernie as well, Circle Friends. You're always in our hearts. Just wanted you to know that, Lynn. And thank you for allowing us to participate in some, it seems so small, but it was really big for our community here, just to be able to donate clothing. And they've been doing a great job of that. And I just think what a great opportunity to inspire our members or our consumers to be active participants in our community in small but meaningful ways. And that was a huge, small but meaningful way to do so. So with that, I thank you, Carrie, for the time. Again, thank you, Peer Team and MHSA and HHSA. So many agencies involved in this. So thank you all for your support of the center.
Oh, love us some Sunrise Mountain Wellness Center. Denise, you had something to add?
I just wanted to promote that the peer supports in collaboration with Sunrise Mountain. We've been able to get off it's a branch off of the Hearing Voices Network. We call it Extraordinary Experiences group that me and Josie run. And it is a group for people who have either auditory hallucinations, visual hallucinations, or maybe even feel that they are from different spirits. It's a place where they get to talk about these things, and there's no stigma, there's no clinical thing. It's just a free place that we can actually open up and get this heavy burden off of us. So instead of having to put it on the back burner and sort of forget about it, this is a place where you can share what that experience is and what it means to you, and so that you can bring meaning and maybe some resolution as to figuring out why that is for you. And so we don't offer answers for people. We let them find the answers for themselves, and that's really a great group. And there's also another group that Josie's doing that is about cultural awareness and stuff like that. It's called Cultural something. I can't remember. I'll let her talk about that. But I'm really excited about the Hearing Voices. It's not only for hearing voices, it's for visions and tactile and for extraordinary experiences that some may offer. And so if you know of anybody who would like to join, just contact Sunrise Mountain, contact Julie, and they'll give them the Zoom and they could be a part of that group. We do it hybrid and in person. If they want to do it Zoom, they can. If they want to meet in person, we try to coordinate so that they can actually feel more supported.
Yeah, and that's a really fun group. So I will do it over at the Woodland Sundays too. I'm still working out some technical issues, but some of our peeps from the Woodlands has joined us, especially last Thursday. So that was a lot of fun and very exciting. And so I'm working on making it a more comfortable atmosphere so our peeps can join in over there and over here, whatever we can do to get them to that group so that we can destigmatize hearing voices. So there's that. And then Carrie, you'll see in the newsletter for Sunrise Mountain Wellness Center that there's a new group that we've constructed called Connecting Cultures. And Connecting Cultures is a group that is peer-centered, and it helps us understand other cultures. We talk about some of the things that maybe wouldn't be spoken about in other spaces. We go there. We talk about microaggressions. We talk about what these things are, and the whole premise of the reason why we would even engage in this sort of conversation as peers is so that we can build more supports, which is a RAP-based concept, so that we can have more outreach and more community, so that we can go further in our lives, because if we can connect with more people, we can go further. If we know how to approach people, we can go further. And, you know, we talk about the very real thing of racial anxiety and what that's like and how that impacts our mental health and what we can do and how we can look at that in ourselves, and how looking at that can help improve our quality of life. And so it's very cool, never been done group anywhere in peer work that I'm aware of. And it's all rap based. And so if that's something that any of you guys are interested in, we do Connecting Cultures every Tuesday at 2 via Zoom, same link for Extraordinary Experiences. And we usually have these really cool conversations. People will have some realizations. I know I do. Jennifer Winchell, she helps co-facilitate with me and makes it this very supportive, non-judgmental atmosphere as we tackle some of these more, I'll call it more filling subjects, more robust subjects in a pure way. So that's Connecting Cultures.
Oh, amazing. Thank you so much for taking the time to explain all of that. What a great, super important program. Lynn, did you want to give us a quick update on how our friends at Circle of Friends are doing?
Yeah, I'd love to. And I'm really excited to go see you guys down in Reading. Often we try to visit other wellness centers. It feels like a million years since we've gone anywhere. But I think maybe that could be one of our first places on our list to visit Sunrise. We'd love to do that. We have been closed as well and are still closed, except for people in the community who need food and clothing, and whatever resources, whoever comes, we try to help them the best we can. That need has just skyrocketed over the last year. So we have our tiny food pantry that used to be like 2 shelves, we have another room for it. So we're happy to be able to help with that. With our participants, most of our participants are in the high risk category for COVID. And so they're still, and many of them still are not vaccinated yet. Some have been. So we're kind of watching as well, trying to see what becomes available and when they can get vaccinated, and really looking for a safe time for us to be together. In the meantime, last summer, we did outdoor gatherings. We took our camp chairs to like 2 different locations where most of our participants could either walk or ride their bikes, something like that. So about once a week we go, we gather for a while and check in and just meet with one another. Masked, of course, 6 feet apart, all the COVID safety precautions. Those were really good for everybody. The face-to-faceness of everything really, really helped. We had to go back indoors with winter up here, but we're thinking about starting that again in April. And we'll continue to do that until we can open our doors. We also decided to do a weekly packages, I'll call them. We send out to about 40 people right now. Half of them are through mail. The other half are door-to-door deliveries in Boerne, the Boerne area. And they usually have a theme. So there's information regarding the theme. There's also information regarding COVID and other things that are going on there, but there are things to do. So they're like puzzle pages and coloring pages. We get a small craft from Oriental Trading. So the ones that we deliver, there's a small craft in there. So something that just kind of helps us bide our time and learn more throughout the week. We've been able to use some of our MHSA money for that, but we also got a grant from Shasta Regional Community Foundation to help with the little crafts and the mailing on that. And we do Zoom 3 days a week. They're not well attended. Most of our folks don't like that platform. So we're always on, we call a lot and check in with folks. So I would say too, the deliveries, the time for making those packet deliveries and those face-to-face times, I think have been really helpful in not only for everybody's mental health, but also we've been able to catch some folks in times when there are other resources and with Hill Country and case managers that could wrap around them quickly if they needed to. So, so it's been an interesting, challenging year. We've learned a lot. I think our staff has grown. We have a staff of 4. I think we've grown closer together during that time, just trying to work this all out and sort of healing ourselves during this past year. So we're doing great, but also looking forward to taking our masks off someday and seeing everybody's faces again. Thanks, Carrie.
We miss real faces, don't we? You may already be aware of this, but your staff and your clients do qualify for vaccine, and mayors and mountain valleys, and I think Hill Country are providing vaccines. So
yeah, thank you. And we're up to date on that. Transportation is a little bit of an issue, but a lot of ours have taken Pitt River as well. Some of our folks have gone to Pitt River. So we're staying up to date on every single participant. So
good, great. That's great to hear. Do any of our other community providers have anything they wanted to share with us before we start talking about COVID recovery? Okay, seeing no green lights, let's talk about COVID recovery. We are all over it. So over COVID, completely done with it and very tired of it. And this is not going to come as a surprise to anyone, we know that there are some significant mental health impacts for people of all ages, shapes, and sizes who are going to need some support over the long term. So I just wanted to kind of open it up without any parameters, because that's usually how I do it, right? And just see what you all think. Like, what are some things that you think that either you or we as the county could do to help get people through the phase that we're in, as we're getting into that, more people are being vaccinated, more people are hopefully, businesses opening up a little bit more. What can we do to help make that process easier for people in Shasta County? Yeah, I know. I don't have any ideas either.
I have a question.
Yeah.
Sorry, made me think. Thank you for that. My head hurts now. But other than, are you referring to like it was kind of I went to, are you talking about how to get the vaccine or get vaccinated, or transitioning from isolation to back into population or community, everything in between? I think I was a little there.
Yeah, no, that's a good question. I was thinking more along the lines of door number 2, and also things like people that have sustained significant economic losses. How do we help them manage that? Our suicide rate did not go up. In fact, it went down in the past year, interestingly enough. But we have had a very big increase in people seeking help or going to our hospitals with drug and alcohol problems. So, if any of those things might provide any seeds of food for thought, maybe people who, like one of you was mentioning, feeling kind of nervous, right? Everybody's excited for things to open back up, but some of us might still be a little bit nervous about that. Like, do I really want to go back to work in the office full time for people who have been working at home? Or do I want to go back to the wellness center where we're so close to people after having been distanced? And what does that look like? So not a great answer to your question, but hopefully maybe some more seeds to spark some thoughts for anything that you all think that we might be able to do to help folks out in wherever they might need it during this time. Yeah, Denise.
I think because we've been isolated so long that all of us, whether you have a clinically diagnosed condition or not, I think that we all have some sense of social anxiety because just getting back together, even though we miss people, there's still some of that underlying fear of, you know, the variants that are going around. And so how much do I have to protect myself? And so a lot of that is coming to surface. So just being able to connect with people, even if it's just that one-on-one. And I forgot to tell you earlier that here at Shasta County, we're now fully staffed with our peer support. We hired in the last few months, we hired 4 new peer support. So there's actually 6 of us now. Oh. Sorry, that was a shameless plug.
I would agree too, Carrie, about that. I know that we've been talking here with staff at Circle of Friends and just kind of nervous about opening the doors. There's always going to be a mix of vaccinated and unvaccinated people. So we're just kind of, we're nervous about it.
I think too, I love what Aya, I'm sorry if I mispronounced your name, I'm challenged. I love what she put in there, something you said too, Lynn, that made me feel more comfortable doing this, and that is transitioning, doing community activities socially distanced in outdoors. So before we can actually get inside, transitioning maybe do an art group or something, or a walking group. Instead of a Zoom room that day, and or hybriding it, and helping people get comfortable going back, like learning new social skills. Like I have to learn to be social again. So one thing to be social with a cat that rolls up on my screen here and scares me every time. And I'm like, what the heck is that? Oh, it's a cat. And then another thing when a human being does it, right? Like, how do I respond to the human? How do I, I don't go and hug them right away. We don't extend a handshake. Some of these things are going to change. Some of our cultural stuff and will be nuanced there. So I love that, having that flexibility that Aya is talking about. In that could be one thing. I think another thing too is having a unified voice from the leaders in this community, saying the same thing and not contradicting one another. That's very confusing and frustrating for the consumer. And just being able to get a vaccine right now, it's so confusing. Do I go to Rite Aid? Do I go to Safeway? Do I go to CVS? Do I wait for the mask? What's going on? And I really appreciate that that's gotten a lot tighter, and gives, for me as a consumer, gives me more confidence that my leaders really do know what they're doing. I can trust their judgment, whereas before that was a little questionable for me. And I say that blanketly in this country because I watched how we just were like going into a really downward spiral for I didn't understand reasons. So I'm wondering if that would be helpful on that, and maybe we could collaborate as agencies to figure out how to support one another. Maybe this could be something a wellness center could take upon themselves too. I'm not sure how to provide support for that right now, as I'm not sure what the need is in that avenue, other than everybody's really excited to open up. We're really economically disadvantaged at this point. Are there grants that could become available through the county or through some federal programming that could be made available? And if so, how can we be helpful in connecting people to those resources?
Carrie, I just want to throw out there that in the face of this pandemic, I know it's been super crippling to a lot of programs and other counties. And in the face of that, Shasta County wasn't crippled. Our services continued, they've expanded, our frontline workers have continuously been out there providing services, and there is a plethora of services right here under our own roof, and collaboration has been huge, just within HHSA, but also, I appreciate, I think it's Tina, just talking about the communication piece, the collaboration piece, being mindful of what we do have in our county to provide, and always just being sensitive and aware that everybody is responding to this pandemic in a different way. And it's certainly, we've seen an increase in need for mental health services and anxiety around even receiving services because of COVID. So I just, just the collaboration, the communication, reminding ourselves that we kept our doors open, we never shut them, and collaborating with our providers and our community, because it's really about community.
Absolutely, yes. Thank you, Janelle, for that that perspective.
I know that in my program at Shasta County Mental Health, I have just started February 1st as the case manager at the Woodlands. And I know that the people, that the residents here are eager to get more access to services that they used to access. A lot of them don't have the ability to do Zoom meetings. We're holding groups here with masking and social distancing. And I have offered with anyone that I work with who wants to get a vaccination, I've helped them schedule it and set up transportation for it. So we're just kind of working toward wanting more services open, and this is what I'm hearing from our clients here. So we're just willing to help anyone access those vaccinations and the services that we know of that are open. So we have a good handle on, what is accessible. Like, I know I've pushed a lot of our clients to do the Zoom meetings through Sunrise Mountain, and helped people in accessing those meetings. So those are the things that we're kind of doing right now. And if there's anything more that we can do, I'm open to those suggestions.
Yeah, for sure. Thank you, Katie. That's great that you're working over at the Woodlands now. Does anybody else have any thoughts or ideas? Simple answers to my simple
I had one.
Yeah, Lynn.
Okay. I started thinking about staff again this year and how this has been for us. I think we're just feeling battle weary. I mean, and we're not the only ones. My son is a teacher. I mean, this school has been open all year after being closed half a year, and the teachers go with, different models, and they're exhausted and tired, and people in the supermarkets have to be tired. Carrie, your COVID group, work group has to be exhausted. I mean, as good as we are at wrapping around each other and ourselves and using our wellness tools and finding balance, it's just been an extraordinary year, and there have to be a lot of battle weary folks out there, I think.
Yeah, most definitely. I mean, usually when we're responding to an emergency, it's something like a wildfire, right? Where there's an event and it's terrible and it's scary and everybody pitches in, and then it's done and we get through it. And it's time specific, right? I mean, of course there's recovery that happens, but I think for a lot of us, it feels like we have been sprinting a marathon for the past year. And you're right, that is not sustainable for anybody. So that's point well taken. And I'm hoping that Chris is collecting all this information in his brain, and he and the Stand Against Stigma committee can just go and fix all of this, because that's kind of what he does. But truly, I think that, with that Minds Matter, with the new fun format, might be a good place to maybe provide some of those resources, whatever they may be. So do stay in touch with us if you wake up in the middle of the night and think, oh, I've got this great idea for helping people cope with the, rebuild some of that resiliency that has been beaten out of us over time. Then let us know, and we'll see what we can do. It feels like there's just like some really, it's weird that we've been physically separated for almost a year, but it's kind of forced us to figure out new ways to stay connected, because not being connected is not an option. So it's kind of cool to see. And I wonder if maybe some of the practices that we have will continue, you know, in the post-COVID era, like, you know, some of the working from home things and, you know, meetings. Do we really have to be going to Sacramento for all these meetings all the time? And, you know, things of that nature. And taking care of each other, not necessarily in a physical, with, you know, with you in the same room as the person who's providing care to you, whatever it might be. Yeah, Julie.
We're going to provide Zoom meetings even after we open and we meet in person. We're going to continue to provide that because there are always going to be people who may not be able to or want to leave their home or otherwise not have transportation and want to be able to connect and participate. So that's something we're going to continue to do.
That's great. And I think that that we'll continue to do that too. I remember back when I started as MHSA coordinator, we sort of tried to put these meetings online. We're like, oh, this is really hard, and who's going to do it anyway? And now, I mean, it feels like it's something that's important to continue doing. If for no other reason, then, you know, we've got a big county, and not everybody can drive 100 miles to be at our meeting in Reading, but we still want them to participate, of course, right? We want everybody's feedback. So, so maybe some of those things we'll do a better job of thinking of other ways to, not necessarily to replace, but to supplement the ways that we connect with other folks. I wanted to point out a couple of things. If you have not filled out, I'm going to move it down here, the demographic survey, it would be very helpful to me if you would do that. I'm going to post it one more time as a reminder. It just reminds me who was here and who we've reached out to and who's participated in our meetings. And then Nicole mentioned a little bit up here in the chat that the Mental Health, Alcohol, and Drug Advisory Board has 2 membership openings. One for a mental health or substance use disorder services consumer, that's how it's described in the law, and a community member. So our mental health board meets every other month, once every 2 months. In the evening, I want to say it's the first Wednesday of the month at 5:15. They've been doing Zoom meetings, but usually they meet at the Bogs down here on Breslauer Way. And that advisory board is made up of people who use mental health services and their family members and community members. And there has to be a certain percentage that does not come to the top of my mind right now, but a certain percentage of each participating in that board, because of course we do not want to make decisions about people without the input of those people. So if you have a little bit of time and a little more than the average heart for your community and want to join that group, you can either reach out to Nicole, or I think she put a link up here. It's a little bit, it sort of disappeared here. Here we go. I'm going to post it down at the bottom too, just to bring that to the top of your chat screen. And you can reach out to me too. Denise, good question. No, it can be anybody who receives mental health services or services for substance use. That would consider them to be a consumer. I'm pretty sure, Nicole, correct me if I'm wrong, but I'm pretty sure that's how that works. Okay, we are coming up to, we've got 3 minutes left. Does anybody have anything that they wanted to add? Throw out there, give us all something to think about.
I'm having a hard time with the link for the survey.
Well, shoot, let me try one more time.
I just had to cut and paste it right into my browser.
Oh, that's because I did it dumb.
Yeah, mine wouldn't take it in the browser. Thank you.
Sorry about that. Okay, Denise, awesome. Have if you want to reach out to Nicole, I think she works right in your building. You guys can connect on that. That would be awesome. You would be an outstanding representative. I don't know if employees can be on the board because they cannot. Okay. Yeah, rats. But if you want to recruit somebody that you know to do it, that'd be great. Okay, if nobody else has anything to add, I will give you back 2 more minutes of your life. Thank you again for participating. Again, I know this is not the ideal format for a meeting like this, but I feel so energized always after these meetings, after hearing about all the great work that everybody's doing. We all get kind of stuck in our bubbles sometimes. So I appreciate that dose of inspiration and positivity that you guys have provided to me. And I will get another meeting on the calendar before the end of this week, so we don't go quite as long without seeing each other. In the meantime, I will let you know as some of these other projects come up, if there are milestone dates that would be helpful for you all to know. We will let you know. And I hope you guys have a wonderful, safe, and healthy day and week. And until we see you all again, thank you so much for your participation.
Thanks, Carrie.
Have a great day, everyone.
Thank you.
Thank you.